remember there was a time when I was working in television, and we had a tour of the station. I think it was one of our premiere nights when, the network and the station would team up. We'd invite people over, and there'd be a party, and there'd be some drinky poos out on the patio. Not for us, we had to work, but for the clients, that's for sure. And somebody said to me, they were sitting in my chair on the desk in the sports chair at that time, and they said, "Do you ever think about it, that at any moment there's going to be 25, 30, 40,000 people who are watching you and judging you on how you look and what you're wearing and what you're saying and all that?" I'm like, no, I never have. And it's just terrifying. And I paused and I said, no, I'm just kidding. Yeah, I have. It doesn't bother me. But you know what? It bothers a lot of people. It does. And there's a word for it. It's in the phrase. It's social anxiety disorder. And you're always feeling like you're being judged, and it can be debilitating. I want to bring in the good doctor this morning to discuss this with us here in detail, talking about our good friend, Dr. John Braccio. You can find his podcast at drjohnb.com with regional psychological services of East Lansing. Good morning, sir. Welcome back.
Well, good morning to you, Dave, and there's no doubt that social anxiety disorder is really an emotional killer for so many people that have it. In general, anxiety is a common human trait that can actually be helpful as we encounter the normal stresses of life. But when just meeting new people, giving presentations, or interacting with others causes us to become anxious to the point we can't function, could even have panic disorders, then we really are in a bad situation. And as you said, these are conditions where we're filled with fear, embarrassment, anxiety, and we're also self-conscious because we're fearful of being negatively judged by others. And these are not just small numbers. An estimated 7.1% of persons in the U.S. have had social anxiety disorder the past year. Females have a frequency of 8% and men 6.1%. So we're talking really about huge numbers. About 1 in 8 persons have had social anxiety disorder at one time or another, and more than 75% of persons who suffer from it first experience the symptoms in early childhood or when they are children. So it's really a struggle if you have this, and it's kind of a silent thing because a lot of times people don't know about it. People will hide around it. They'll stay away from jobs that require some level of interaction or more than just talking with people.
Sure.
And then you have people that will even lower their grades or stop having promotions or movement upwards by completely staying away from giving presentations or interacting with others. So it can really be a very, very debilitating condition. And when you figure 1 in 8 persons has had it or is going to have it, that's really a lot of people if you really think about it. It's not just an every now and then person has it. No, we're talking about 15, 20 million Americans. That's a pretty large number by any standard.
No question. You mentioned childhood. I remember one of my daughter's ballet classes, their recital, and there was another little girl who, when she got on the stage, she froze up, and she could literally not move for the entire performance. And the fear, and all of us could see this, and you want to look away so that it was hard to do that. And I thought that then now the trauma of having gone through this will ferment in this child's mind as she's growing up. And I thought, what is it? And how do you get over this? And how do you console them? And any parent would see this and just be, your heart just sinks, You feel so bad, but you're powerless at the moment. So her father came up and actually picked her up and took her back out. But those are the kind of things you're talking about, right? To begin early, something happens.
Yes, and the problem is they're reinforcing, which is even worse. Meaning, if you have a bad experience, it can lead to another bad experience, and then it can lead to never wanting to have that bad experience again. So unless you get some type of treatment or you somehow can wander out of the woods yourself, it can be a very, very difficult thing. And another thing, we can add new things too. So as we become fearful of maybe interacting with a certain group, we can add it to another group and keep adding to the point that we can have a very, very narrow world, and it really can impact our social interactions, our professional interactions. It really can negatively impact all aspects of our life. So it's a very, very difficult situation to have, and the panic attacks that can come.
Well, you mentioned the word "had," and that filled me with optimism, because if someone had this, that means then they don't have this anymore, or they have found a way to deal with it. Now, so what are some of the ways that people can? Is it something that a person can be cured of, or is it something that they have to kind of wrangle, and it'll be there in their life, and they just have to know it and find ways to deal with it? How does it work?
Well, it can be a little both, but I believe, yes, people can clearly get over it. It's, there are different strategies that can be used. Usually it's some combination. One, we're talking about therapy, counseling, and cognitive behavioral therapy is generally the most effective. This is where you confront the issue itself. Okay, you get in a situation where the cognitive restructuring, if a person says, I know I'm going to be fearful as I go in, they have to be able to say, no, I'm not going to be. I'm going to confront this. I'm going to be going in. I'm going to be dealing with this. And a part also is education of the person, that the person can understand, be aware of what the sources of the social anxiety are and the symptoms that occur. It's really an educational process. And then part of the cognitive behavioral therapy is actually where you go out and you, little by little, confront the situation. We'll kind of take, one that most of us are familiar with, the plane, okay, in terms of that type of anxiety.
Right.
So much the social, but it's the idea. So what you try to do is you get used to start thinking about a plane in your own mind. You start even going to the airport and watching planes, coming, going in, going up, this type thing. And you start preparing yourself. You get to the point where even though you haven't done it, you have been practicing it in your own mind. You're doing visualizations. And these are important things to do. And then you just kind of go at it, because eventually you do have to confront these things. But often if people do this, it can be very helpful. And also medication has been deemed appropriate. There can be, and we're talking about the SSRIs. These are the serotonin reuptake inhibitors that would include Zoloft, Celexa, Prozac, Lexapro, Paxil. These are the type of medications that are found to be helpful. So generally, not that you always need the medication, but you generally do need some form of the counseling to the point that you can understand what the problem is, what causes it, and then you have to find a way to confront it and go at it. And even if you're going to be never completely secure or completely feeling no anxiety in situations, and by the way, most people giving the large presentation still can have some anxiety, but you get to the point that you can cope. And I have worked with many people that have really completely gotten over it once they realize kind of not only I don't want to use the absurdity, but when they realize how it's destroying their lives and how they're so fearful, it may even hurt them in terms of job performance, job opportunities, social interactions, even finding a spouse or dating or doing things, then they can get to the point, no, I'm going to move on, I'm going to be free of this. So there can be positive solutions, Dave. The problem is if you let these things go, they can grow, and you can be limiting yourself more and more and more. So we really need to, if we have this social anxiety disorder, and we're talking 15 to 20 million people in the country, we do really have to confront it, to understand what it is, and we have to take definite strategies to overcome it. And these are things people, of course, can work on themselves. But I think in most cases, or many cases, it is helpful if you have a guide in terms of a therapist, and then the potential medication, particularly if you're getting panic attacks or get to the point that you're having
because you've been able to help a lot of people
symptoms.
Who have this particular disorder. You've been able to help them and to start living their life again, as opposed to
that is true.
Because
that is true.
This causes people to withdraw so much that it's hard to say they're really living their best life, or they're not living the life they could be if they were able to overcome this. So you've had good success. But the way you described that kind of balance, you had the medication, but the counseling was hugely, you said, cognitive behavioral therapy.
That
was
tends to be the
essential
most
element.
helpful.
The most
Well, I think that's true, Dave. And one of the things nice about changing anxiety in persons, you can actually, in a relatively short time, you can see a lot of success from a therapist's point of view. A lot of deep ingrained depression is much more difficult to deal with, or even the generalized anxiety where someone's anxious about anything and everything. Those are broader based, type things to deal with. But social anxiety is often a very specific set of facts. It can be one situation or two situations. But once the person understands it, they recognize how it's debilitating their life, and they really desire to change, then all the tools are in place in terms of, like you mentioned, generally the combination of some type of medication and cognitive behavioral therapy.
Right.
And if we want to use a different word, it's where we basically understand the problem, we confront the situation, we do gradual, really where we gradually introduce ourselves to it, to the point that we can overcome it, and then we can kind of move on with our life. But it is something that it's important to overcome, because if you have it, and a lot of people have it, and you don't get over it, and many people don't get over it, it can be debilitating, and it can definitely have an impact on many aspects of your life.
The third most common mental disorder in these United States, social anxiety disorder. The solutions, though, are there. And you can reach out to that. You can also reach out to Regional Psychological Services in East Lansing, our good friend, Dr. John Braccio there. And the podcast, this will reside there with many podcasts very shortly. And those are all available to you at drjohnb, B as in boy, .com. Always great to talk to you, my friend. Have a wonderful day.
Same to you, David. Enjoy our almost Caribbean-like weather today.
I know
enjoy these weather.
It's our version of spring, and when we get to mud, we know it's there. Thanks, Doc. Take care. We're back in the morning wake-up shortly. 1320 WILS.